Discovery of a malaria vaccine is a major breakthrough in health. Did you know that this vaccine is only 40% effective? And why has it taken over 30 years to develop a malaria vaccine while in under 1 year the COVID-19 vaccine was ready? Maria Yambo visited the Lake Victoria area, a malaria endemic zone. Here she met Dr. Simon Karuiki, one of the lead researchers behind the recently approved World Health Organization RTS S malaria vaccine. Now she tells us more. Let's take a look.
Beyond the shores of Lake Victoria lies an epidemic that has ravaged this fishing community for decades. Every year, malaria kills more than 400,000 people globally, according to the 2019 WHO World Malaria Report. In Kenya, children under the age of 5 years are the most affected. These statistics are alive in the 8 malaria endemic counties of Kisumu, Siaya, Migori, Homa Bay, Kakamega, Busia, Bungoma and Vihiga. Dr. Simon Karuiki, a Chief Research Officer at the Kenya Medical Research Institute and Center for Global Health Research in Kisumu, has 26 years' experience in the field of malaria.
They shrink.
Yes. He knows too well how bad the situation has been for this community.
We owe it to our population and our communities to try and lessen the burdens of infectious diseases that affect them, not only in terms of the deaths, but also economically, because they miss going to work, they miss taking their children to school because of the malaria and so on. If you went to a primary school and tested 100 children, you will find 80 of them out of 100 will have malaria, 80%. Now, if you do the same now, you will probably get 30 out of 100.
Though malaria-related deaths have come down significantly, it has taken 37 years of numerous scientific attempts to develop an effective malarial vaccine. Unlike the COVID-19 vaccines that took just months to develop, the researchers tried to explain this out.
You see this thing with inside the red blood cell?
Yeah, I can see it.
A virus is very tiny and it's probably very easy to seek, even to know its protein content. It's very easy to inactivate that virus and then use it as a vaccine to vaccinate people. Parasites are very large organisms, and therefore even knowing which part of the parasite you can constitute a vaccine is not easy. Malaria even has more challenges.
To understand why the WHO approved malaria vaccine that is only 40% effective is a big deal compared to other childhood vaccines like measles, which is 97% effective, and the chickenpox vaccine that prevents over 90% of cases, let's delve into how humans are affected by malaria. The malaria parasite life cycle is very complex. During a bite by an infected Anopheles mosquito, saliva which carries the malaria parasite is injected into the human bloodstream. The parasite journeys to its first target, the liver. And in the liver, the parasite undergoes hundreds of nuclear divisions, producing thousands of new parasites, which burst out of the infected liver cells and journeys back to the bloodstream to infect healthy red blood cells. It is at this point that the malaria victim suffers fever and chills, and if no medical attention is sought, severe cases of anemia, seizures and respiratory problems set in. Dr. Karuiki was instrumental in the clinical trials in Kenya. He says the severe cases is what the vaccine seeks to avert.
Reducing clinical malaria by even 40% is so important, because it's that clinical malaria that eventually in young children develops into severe malaria and can lead to death. So this vaccine has potential of saving hundreds, thousands of lives in areas where malaria is endemic in sub-Saharan Africa.